Cancer is the leading cause of death worldwide, and although scientists continue to hone the way to implement new treatments, cancer must be framed into the public mindset not just as a curable disease, but equally as a preventable one. Indeed, some screening tests are able to find a cancer early enough to intervene and prevent it from becoming life-threatening. That's why you shouldn't wait to be checked until you have a lump in your breast or blood in your stool, because the cancer may not be anymore in its most treatable stages. If you are in good health and you feel totally fine, now it is the right moment to be screened. For the average risk woman, it is recommended to do a Pap test and HPV test starting at age 21 to check for cervical cancer. These exams are relatively painless, and they consist of scraping off a little tissue from the cervix to look for possible anomalies. If the results are normal, they should be repeated every 3 years. At age 40, it is important to start a yearly breast exam and mammogram to check for breast cancer. A mammogram is done with a machine that presses the breast tissue between 2 plates to make an X-ray image of it. Some women may feel pain during the procedure, and others may not feel anything at all. The pain level may vary with every mammogram you receive depending on the size of your breasts, the timing of the exam in relation to your menstrual cycle, and the variations in positioning for the mammogram. How often it should be done depends on age and family history. Starting at age 45, it is recommended to undergo routine screening for colon and rectal cancer up until age 75. The most common procedures are colonoscopy and fecal test. For the latter option, the doctor collects a stool sample and looks for tiny streaks of blood in the stool. If any blood is detected, the doctor proceeds with a colonoscopy. During a colonoscopy, while the patient is sedated, the doctor inserts a long flexible instrument into the rectum and threads it up through to the other end of the large intestine. The instrument transmits images of the inside of the colon, allowing the detection of abnormalities. Since the procedure is generally conducted under total anesthesia, it doesn't hurt, but afterwards it may cause an uncomfortable, gassy feeling. Patients should receive the fecal test every year, while a normal colonoscopy only needs to be repeated once every 10 years, or upon receiving abnormal results from the fecal test. In addition to these, if there is a family history of ovarian, breast, uterine, or colon cancer, a transvaginal ultrasound must be done to detect the presence of a possible ovarian cancer. A transvaginal ultrasound consists of inserting a thin ultrasound probe into the vagina. The probe is covered with a protective sheath similar to a condom with some lubricating gel on it. The test may be uncomfortable and a little cool from the gel, but shouldn't hurt. Another option consists of collecting a blood sample to detect the presence of a certain protein, the CA-125, which may be a strong indicator of the disease, but not exclusively. Indeed, its presence may be due to other conditions such as endometriosis and pelvic inflammatory disease. Also, not everyone who has ovarian cancer has a high CA-125 level. Most women will only need regular screenings for cervical, breast, and colon cancers. However, you should do annual visits with your primary care provider and ask if you have any special risk factors that may portend a need to screen for other cancers, such as skin, lung, or uterine. Remember, screening has helped lower the U.S. cervical cancer death rate by more than 50% in the last 30 years. Mammograms prevent 12,000 deaths each year, and if everyone followed colorectal cancer screening guidelines, 33,000 lives would be saved each year. If you liked the video, give it a thumbs up and share it with your friends. For more topics and tips, subscribe to the channel.